I am Samuel Kimani, an associate professor at the University of Nairobi, Department of Nursing and Midwifery. The University of Nairobi has a center called ACCAF. ACCAF stands for Africa Coordinating Center for Abandonment of Female Genital Mutilation stroke cutting. ACCAF, which is also a consortium member of the TGG-ARM. The inspiration behind integration of FGM prevention and response into development programs and especially health sector was informed by a study we conducted in 2018, and it is tried to establish the preparedness of health system to be able to prevent and respond to FGM. One of the key findings from this study is that health sector was inadequately prepared in terms of responding to complications that arise from female genital mutilation. We realized the problem could actually be from where we are training and generating these healthcare providers. And we quickly thought around and we started to say, why don't we look at the curriculum that we use to train our medical doctors, nurses, midwives, and other healthcare workers? And to our amazement, we realized that most of the training on issues to do with FGM, they were all undergoing this training for only 2 hours. As ACCAF, what we did is to come up and develop a more structured curriculum for healthcare trainees and healthcare workers.
I'm a Kushite from Moyale. So I luckily evaded the act because, one, my brothers were against my parents let me go through the act because they were learned and they know the harmful complications brought about by FGM. In my community currently, I'm considered like an outcast because I have not gone through the act, and they think like I'm not a woman enough. To be honest, I feel like a queen, princess. The privilege that my brothers made me have really made me feel like I stand out.
My expectations from the training were I wanted to know about the prevalence of FGM in our society, from the counties that are still practicing FGM, where it is most prevalent. That was really captured in the session.
What really motivated me to sign up for this training is first and foremost, I'm from the KU community in Marakwet, and FGM is still being practiced. And secondly, I'm also a girl, and I believe that girls also have a right to live in a world free of harm, free of violation of their fundamental human rights, and also preservation of their dignity. From this training, we've also learned the adverse effects ranging from infertility, infections, and grave adverse effects such as death. And with this, I'll be a better advocate when going back to my community.
ACCAF curriculum integrates both clinical and theory. We are able to train them in classroom, and the classroom teaching for the student takes 2 days. And this is delivered by ACCAF trained medical lecturers.
I'm really honored that I was among the champions to be trained by ACCAF in helping integrate female genital mutilation as a training curriculum in our medical course. So one of the beautiful part is it looks at the basic anatomy of a woman, which we actually do in our basic curriculum. But then when it comes to the other components, like the drivers of FGM in our community, when you look at the complications that our women go through, and also the interventions that we can do, all the way from community-based intervention, medical legal interventions, you realize that most of our curriculums do not touch on that. And that's the beauty of actually bringing that in our colleges to train it as a special course and as a special unit for the student.
The curriculum has helped the medical students, and they are willing to champion against this vice. And it has also helped the students to understand the issues surrounding FGM.
Right now, they know that they have a role in management of obstetric complications, which may range from physical, they may range from even psychological, and even their role in community engagement to abandon the practice.
The course has prepared me in handling such cases by a way that I'll be able to counsel those who have undergone FGM.
Good morning. We come to see I'm also from the Kisi community, which has a high prevalence of cases of FGM. This knowledge will help me educate more people back in the community on the dangers of practicing FGM.
I'd like to thank ACCAF and the Girl Generation for bringing us this opportunity to learn more about FGM, which will enable most of the students who were there help in the eradication and advocacy against FGM.
Okay, good. I'm ready.
It's easier when you're talking one-on-one than when you're on camera.
I thought you should turn your camera as well.
Cats.